Recovering from bypass surgery is a journey that requires patience, awareness, and the right guidance. And in this video, I'm going to walk you through exactly what to expect from the day you leave the hospital up to 3 months after surgery, so that you and your family feel confident and prepared instead of anxious and confused. Because one of the biggest challenges I see as a cardiac surgeon is not the surgery itself but what happens after discharge, when patients go home and are unsure about what is normal and what is not. So let's start with the first phase, which is the day of discharge in the first week at home. This is the time when your body is still healing from a major operation. Your chest bone has been opened and wired back. Your muscles are recovering and your energy levels are low, so feeling tired, weak, and slightly breathless with activity is completely normal. Most patients also experience mild pain or discomfort at the incision site, especially when coughing, laughing, or moving, and this is expected. But what is important in this first week is not complete bed rest. Many patients make the mistake of lying down all day thinking they need to rest. But in reality, gentle movement is critical. You should start walking short distances inside your home, even if it is just for 3 to 5 minutes at a time, multiple times a day. This helps prevent complications like lung infections and blood clots. Your breathing exercises are equally important, using an incentive spirometer if you were given one, or simply taking deep breaths regularly, helps your lungs expand properly. Now let's talk about sleep, which is often disturbed in the first week. Many patients find it uncomfortable to lie flat, so using extra pillows or sleeping in a slightly propped up position can help. Appetite may be low, digestion may feel slow, and constipation is common due to medications and reduced activity. So ensure adequate hydration, fiber in your diet, and follow your prescribed medications strictly. Now moving into week 2, this is when you will start to notice small improvements. Your pain will gradually reduce, your walking capacity will increase, and your confidence will begin to return. But this is also the phase where patients sometimes overdo things because they start feeling better. And that can be a mistake. Remember, your sternum or chest bone is still healing. So avoid lifting heavy objects, avoid pushing or pulling movements, and avoid sudden jerks. Walking should now be increased to about 10 to 15 minutes at a time, 2 to 3 times a day. You can start doing very light daily activities like dressing yourself, eating at the table, or light household movement, but nothing strenuous. Your diet becomes very important from this stage onward. Focus on a heart-healthy Indian diet, which includes less oil, low salt, avoiding fried foods including fresh vegetables, fruits, whole grains, and good protein sources like dal, sprouts, and lean meats. If you consume non-vegetarian food, avoid smoking and alcohol completely. Now coming to week 3 and 4, this is the end of your first month after surgery, and this is where recovery becomes more noticeable. Your stamina improves. Walking can now be extended to 20 to 30 minutes a day depending on your comfort. Many patients start feeling more like themselves again. However, fatigue can still come in waves, which is normal. One important aspect during this phase is mental health. Some patients experience mood swings, anxiety, or even mild depression after heart surgery, and this is something that should not be ignored. Talking to family, staying engaged, and understanding that this is part of recovery helps a lot. You may also have your first follow-up visit with your doctor around this time, where your wounds are checked, medications are reviewed, and further guidance is given. Now let's move into the second month, weeks 5 to 8. This is where structured recovery begins. Your walking should now be more consistent, around 30 minutes daily, possibly split into 2 sessions. If cardiac rehabilitation programs are available, this is the best time to enroll. These are supervised exercise and recovery programs designed specifically for heart patients. Your energy levels will improve, and you can start doing slightly more activities like light cooking, short outings, and some desk work. However, heavy lifting, gym workouts, or intense physical activity are still not recommended. Your diet and medication compliance continue to be crucial because remember, bypass surgery treats the blockage, but the disease process needs lifelong management. Now coming to the third month, weeks 9 to 12, this is when most patients reach a stable recovery phase. Your chest bone is largely healed, your stamina is significantly better, and you can gradually return to many normal activities. Depending on your profession, you may be able to resume work. Especially if it is not physically demanding, driving can usually be restarted after your doctor's approval, and your exercise capacity improves further. But even at this stage, discipline is key. Continue your walking routine, maintain your diet, and do not stop medications without consulting your doctor. Now, throughout this entire recovery journey, there are certain warning signs that you should never ignore. These include increasing chest pain, severe breathlessness, swelling in the legs, fever, redness or discharge from the wound, irregular heartbeat, or sudden weakness. If you notice any of these, you must contact your doctor immediately. Do not wait, because early intervention can prevent serious complications. One more important aspect I want to emphasize is family support. Recovery is not just physical, it is emotional and psychological. Patients recover better when they feel supported, understood, and encouraged. So if you are a family member watching this, your role is extremely important. Help the patient stay positive, ensure medications are taken on time, encourage walking and healthy eating, and most importantly, be patient, because recovery is a gradual process, not an overnight change. By the end of 3 months, most patients are able to return to a near normal life. But the journey does not end here. This is the beginning of a new lifestyle, one that prioritizes heart health, regular checkups, controlled diet, stress management, and physical activity, because the goal is not just recovery from surgery but prevention of future heart problems. So if you or your loved one has undergone bypass surgery, remember this: every week will get better if you follow the right steps, stay consistent, and listen to your body. And if you found this guide helpful, make sure to share it with someone who needs it, because the right information at the right time can truly save lives.